want to send in your questions and short video clips. Let's play the first one, right?
Hello, Trevor. This is Dennis from Nakuru. I'm a huge fan of Monday Report, and my question to Mr. Patrick is, how can a family of 10 living in a 2-bedroom house practice social distancing? And again, how is it possible for one to stay at home while he has to feed for the family? Thank you so much.
All right, Director General, did you hear that? The question from Dennis?
Yes.
Yes.
I had Dennis, a family of 10 in a 2-bedroom house, yes. How to ensure social distancing.
Yes, sir.
It is still practical for a family of 10 to be able to maintain social distancing in a 2-bedroom house, taking into consideration the infection prevention control measures, the hand washing, the use of the sanitizers, and if there's nobody in the family that is affected, then that is possible. However, if it is a question of isolation, then it is not practically possible to keep 10 people in quarantine in a 2-bedroom house. And that is why we are talking of additional quarantine facilities in all the 47 counties.
All right.
The idea of fending for how do you stay at home and you have to fend for your family, I would rather you stay at home and help your family live, rather than avoid taking into consideration these measures, and then you don't have a head of the household of the family.
All right. Let's bring up the next question again.
Douglas, why don't we stop the public vehicles ferrying people in and out of Nairobi and allow the vehicles ferrying foodstuff the same way we did with the cargo flights? By this will help the movement in between the counties.
All right, Director General, why don't you allow vehicles ferrying foodstuff into counties? I was wondering, why don't you allow vehicles that are ferrying foodstuff? Why don't you allow vehicles that are ferrying foodstuff into counties rather than stop them because they are trying to ensure people get fed?
That was clearly stated in the announcement that was made, that vehicles ferrying foodstuffs are allowed unfettered access because people have to eat in spite of the coronavirus disease outbreak.
All right. Let's bring up the next question.
Oh, I am Jared. I have just one concern. Whatever the government is trying to tell us, all the precautions are just meant to stop the spread. But now, at what point in particular is Kenya going to be a free nation, a corona-free nation? Is it when all under quarantine and those the so-called contacts have tested negative? Because there is I want to believe there is a confusion here. Thank you.
All right. DG, at what point will you be corona-free?
We'll only be declared corona-free country when the last person in quarantine has been removed after testing and has tested negative on 2 consecutive occasions, and there is no more local transmission of coronavirus disease.
All right. Let's bring up another question.
My name is Gilbert, and my question is, for those people who tested positive for coronavirus, was the government able to get the specifics of the kind of interactions the people had with the people they contracted it from? For example, did John shake hands with the mayor, or they were in the same matatu and someone coughed, something like that?
All right. DG?
Can I get that again, please?
Yeah, I was wondering, were you aware, did you know how the people who got the virus contracted it? Did you know whether the interactions were through handshakes, were they through coughs, were they in a matatu? That's when it was transmitted. Do we know how the transmission spread on specific individuals?
The main mode of transmission is through droplets. That is when somebody coughs or sneezes. But also the virus can be able to be deposited in any surface, and if you touch that particular surface and touch your mouth, your nose, or your eyes, then you could be able to transmit the virus. So it is very, very difficult to tell from whichever source the infection arose from. But those are the 2 modes of transmission.
All right. Let's bring up another question.
why this government is not taking advantage. They are only playing in towns instead of coming in door to door and testing people instead of just testing those who are in quarantine. Thank you.
All right. DG, why don't you test people door to door instead of testing people who are just in quarantine?
We have started mass testing, and we started with the people who are in quarantine because they are the highest risk. Remember, these are people who came from outside Kenya, some of them epicenters of transmission of the disease. So in terms of risk profiling, it is only logical that we start with them. And as we ramp up our testing capability, I'm glad to inform you today, Trevor, that we have a new lab again, at a new laboratory at Cambridge CDC, which is now going to give us an additional testing capacity of 100 samples in 24 hours. So as we go ahead, we'll be able to reach each and every person that requires testing. Taking into consideration again that the test kits, there's a global supply challenge. But as at now, we got the test kits from Jack Ma Foundation, which is about 22,000, an additional 6,000 from WHO. The ministry has procured an additional 6,000. So for now, we want to clear the people who are in the quarantine facilities and any other person who has made contact with any suspected COVID case, who is either admitted at the isolation disease unit in Kenyatta or reported anywhere else in this republic. We shall be able to reach you and be able to test you and tell you your status and take appropriate action.
Okay, let's bring up another question.
This gets more serious. Does the government have any plans to isolate the elderly people who are now at high risk of getting this disease and who may be affected? Does the government have another plan to isolate them so that we can save their lives?
DG, I think that question is how you're going to ensure that vulnerable people are taken care of, like the old people in the society?
The old people in the society, remember in our press release this afternoon when Cabinet Secretary addressed the nation, one of the issues he highlighted in his address was that those of us who are in the urban centers, those of us who are in Nairobi, Mombasa, please let's stay in Nairobi. Let's not go back to the village where our mothers, our elderly fathers, grandfathers are. The government does not have a plan of putting the elderly people into isolation. Furthermore, we have put measures into place, including those who are working and who have chronic existing condition, for employers to be able to allow them to work from home. So therefore, making social distancing a possibility. On top of that, of course, even those elderly people, wherever they are, must practice infection prevention control measures, including hand washing and social distancing.
Okay. DG, so some countries now in Western Europe are already doing antibody testing to patients testing negative after confirmed COVID-19 infection. So it helps reduce the risk of reinfection. So is it a possibility that we're going to develop herd immunity, and are we as a country considering that?
Oh, it is difficult to tell whether we are going to have herd immunity, because even people, we have reports of people who had tested negative and got reinfected again. The use of rapid test kits, which are antibody-based, of course, will be the game changer. But you don't want to rush into this, considering the magnitude of this problem, without the necessary measures being put into place into the credibility of the test kits that you are going to use. Yes, plans are in place, especially in Europe and the Americans, and very soon, maybe in the next 3-4 weeks, we shall be able to have rapid testing kits. This, of course, will be able to help countries like Kenya, where we may not be able to achieve testing with the capacity that we have using the current system we have in place called the PCR. So as soon as we get the rapid test kits, which are accredited by WHO and other institutions like the FDA, Food and Drug Administration of the US, then I'm sure we shall be quickly able to deploy the same resource to be able to increase our testing capacity.
All right, let's bring up another question.
My first question is this. As we speak, how many local textile industries do we have in Kenya that can manufacture PPEs? Underline the term quality PPEs? My second question, Daktari, as you know very well, worldwide we have a shortage of ventilators. So, as Kenyans, do you have any local industry that can manufacture ventilators as we speak? Thank you.
DG?
Thank you. I had made a comment regarding local manufacturing of PPEs, and I mentioned Rivertex and Kikotech in Kitui, who are doing this on a trial basis, and whatever they are going to manufacture in terms of PPEs will undergo rigorous testing through the Pharmacy and Poisons Board, the Kenya Bureau of Standards, and all other regulatory authorities to ensure that what is manufactured locally meets international standard. In terms of ventilators, correct, you say this local global supply challenge with ventilators, and I mentioned that we are in discussion with Jomo Kenyatta University of Agriculture and Technology and Dedan Kimathi University for local manufacturing of ventilators.
All right, let's bring up another question.
Hi, Trevor. My challenge the government could be, let's handle Nairobi differently, so that because we have identified a hotbed for this kind of a disease, let's look at Nairobi County differently, so that at least we protect other counties from the same infection. That's my thought and my simple advice to the government.
All right. DG, is there any special arrangements for Nairobi being what he calls the hotbed of the virus?
Yeah, Nairobi for now is our hotspots, followed by Mombasa and Kilifi. And we are monitoring the events as they unfold in Nairobi. And we'll keep you updated on each and every day of the progress that we are making and the measures that we are going to undertake going forward.
All right. Let's bring up another question.
Humphrey, I would like to ask the government also to consider people in the village. They're supposed also to give them some information about the coronavirus. And how will they do so in order to make all Kenyans are in a position to fight against this COVID-19?
All right. DG?
Thanks for that question. The fight against corona is, of course, a whole government, a whole society approach. Very soon we'll see us coming to each and every part of this country with information, education, and communication material on how they can be able to protect themselves against coronavirus. The resources that we got initially were deployed especially into getting personal protective equipment, ensuring that we have test kits, ensuring that we have capacity building of the healthcare workers. Now, going forward in the next few days, we shall be able to provide each and every person in this republic with the correct information regarding coronavirus on a language he or she best understands.
All right. Let's bring up another question.
Hi, my name is Sumaya Hussein, and my question is, if worse comes to worse and there's a total lockdown in the country, will the government be able to sustain the hand-to-mouth workers in terms of distribution of food?
DG?
The government is working through a multi-agency approach, a whole government approach, and all those discussions are going in terms of what roles the other arms of the government will play, the role of the security agencies, the role of the Ministry of Agriculture, the role of the Ministry of Health, of course, the role of the Ministry of Environment, and based on that, we'll be able to come up with a plan to ensure that every Kenyan is taken care of, irrespective of where he or she is as we fight this pandemic.
All right, let's bring up another question.
Trevor, my name is Martin from Nairobi. Dr. Amoth, kindly make Kenyans understand how possible it is to have 4,000 positive cases the next 1 week, bearing in mind our testing capacity has proven to be 300 cases within 24 hours. Does it mean half of the cases to be tested the next 7 days is likely to be positive?
DG?
I explained that in my opening remarks in terms of the modeling, of how what the modeling takes care of, which includes the susceptibility to infection. This is a new infection. We don't have any immunity. So all Kenyans are predisposed to getting this infection. I talked of the number of exposed people who are incubating the disease, whom you may even be able to test, and some of them will be able to turn negative because the average incubation period of this disease is about 5.1 days. So you could be able to test me on day 2. I'm harboring the virus. I test negative. That is why our main focus has been prevention, prevention, prevention. Because even if you are to test, you are going to end up with people who test negative, but they could as well be harboring the virus. So this modeling is based on those 4 parameters, and it is scientifically done. It is not only done for this disease, it is done for malaria, it is done for HIV. It is the same projection we use for census, it's the same projection we use for registration during election time, based on the projections.
Director General, earlier on we heard a story about a lady called Sylvia Mora. She has a family, a young boy who's autistic. Is there a special plan for persons living with disability or people who have special needs children in the fight against COVID-19?
We will not leave anybody behind in the fight against COVID-19 disease, because whoever you leave can become the potential source of that infection, who spreads it to 4 next people, who spreads it to another 4 times 4 times 4 times 4. So everybody will be taken care of. In fact, even now as we speak in the quarantine facilities, we have people with special needs for which, especially at Kenya Medical Training College in Nairobi, the government is taking appropriate measures to be able to address their needs. So anybody with any unique need, their needs will also be taken into consideration as we fight COVID-19 disease.
All right.
Because everybody is predisposed. Okay. Nobody, be it a Prince Charles, be it the Prime Minister, Boris Johnson, be it the spouse to the Canadian Prime Minister, this disease makes us equal. It can affect anybody, including a doctor like myself.
All right. Let's bring up another question.
Hello, Trevor. My name is Mathis and I'm from Curfew. My question to the government is, how are they handling deep rural areas, cases where these people are not aware of the signs and symptoms of the disease? Because the government seems to be only concentrating to the urban centers areas, only leaving behind the rural areas.
DG?
Trevor, I talked of capacity building, that we have already done capacity building for all the 47 counties. And we are working with the county health management teams to scale up training and capacity building to the sub-county level. We have also, working with AMREF and Red Cross, engaged more than 40,000 community health volunteers spread out throughout the entire country to be able to reach each and every village and each and every community with this information. I told you earlier that the resources that we got were initially deployed to purchase PPEs, to ensure that we have the testing kits, to ensure that we have capacity building. Going forward, the additional resource that is coming our way, we are going to employ this resource in communication so that we pass this information to each and every Kenyan in a language he or she understands, wherever he or she is.
All right. Let's bring up another question.
Is like if the government could try to improve the transport sector, like issuing the NYS buses to the CBDs, at least before the curfew time elapses, or we get to the curfew time. All these people who are in the CBDs, who are trying to chase the jam, who are trying to chase the traffic, they can at least get a free transport, a free drive to their vicinities, their staying areas.
DG?
Thanks for raising that question. And curfew time was imposed because it makes scientific sense, because most of us socialize in the evening after a hard day's work, and that is when we lose the social distancing. So that is why curfew starts at 7. As a government and His Excellency clearly indicated, and the Cabinet Secretary has also emphasized in his daily press briefs, the need for employers to be able to release employees in good time. And I want to thank some sectors of this economy of this country, like the banks, who have worked around their official working hours so that by 3:30 they have closed business and they are able to release the employees home in good time so that they can be able to beat the curfew deadline. This we need to do together so that we can also be able to work around the employers can also be able to work around their shift system so that instead of having everybody come in at the same time, why can't we have some people come in earlier, say they come in at 7 and they leave by 12. Another group can come in by 9 and leave by 3 o'clock. These are temporary measures. We know they are painful. But if we have to impose a curfew, it will only take place for 14 to 21, at most 30 days. So it is difficult to understand as a government. It's difficult times, but these are extraordinary times. So they call for extraordinary measures for us to be able to beat this virus.
All right, let's bring up another question.
I have a question for the Director General, MOH. How is the curfew 7 to 5 combating the virus, where else we have Kenyans interacting during the day?
DG?
I've just alluded to that in my previous remarks, that most of us tend to socialize in the evening. And remember initially when we said the bars will close at 6:30, many bars continue to operate beyond those hours. During the day, we have implored Kenyans to stay at home. And many Kenyans have heeded our call to stay at home. Yeah, and you can be able to attest to this if you look at even the traffic flow. If you look at the number of people in the CBD and in other places of work. The reason that the curfew starts at 7 is that in the evening, people tend to socialize more. And when we socialize in the evening, sometimes we even have our drink. And we can let go of our cool and then forget about the social distancing. That is the essence of the curfew. And the essence of the curfew is to stop the transmission from one person to the other.
All right, DG, stay with me. I'm taking a quick break here and also allow you to take a glass of water. Then when we come back, we have a few more questions and then we'll call it a night. I know you've had a long day. Stay with Monday Report. We'll open the phone lines, maybe 1 or 2 calls if you're lucky enough, and then call it an evening. All right, see you in just a bit.